don't because you get going to the CND. So we're a bit of a channel for that noise. And those in particular are most affected by, however we want to characterize it, policies, abuse, affected by the consequences. So let's just on that, we're trying to reframe what it is we're trying to say here. This is not meant to be specific on policies or drug use particularly, it's about bringing that noise back. So if somebody can help with that.
That's right. It's just the services doesn't really say much.
Continuum of service.
I would say we will.
I think we started this discussion, and because the green closely labeled us in self-definition,
I could stand like there and at least point.
And can thus be uniquely placed, make contact with, and give voice to the individuals, families, and communities most affected by the adverse health, economic, and social consequences associated with drug use.
Right after paragraph 3, and that basically, we put it up on the screen there, acknowledging the human rights abuses against people who use drugs as an affected population, and encouraging member states, the UNODC, and other relevant organizations to solicit the participation of all affected and stigmatized populations in identifying and responding to those human rights abuses. And
Never seen that occur at the UN forum asking for NGOs to identify themselves. You're accredited and you're allowed to be here. So I think out of respect for the reciprocity of the process, I would not ask that, I don't think it's a secret. We can list everyone who has attended, but in terms of having people say, here's who I am and where I'm from, I'm not sure it adds to the deliberations specifically. So I would deny the request, if that's all right. What the wording is referring to in terms of welcoming, yes, that's right, to adopt and implement. May I suggest as a way that might get us out of our prevent misuse conundrum, because the essence of what we're trying to communicate here is welcoming the conventions and the role and the flexibility afforded within these and the role of managing CND, full stop. Could we stop at CND? We acknowledge the United Nations.
Meaning that it's not enough to work with treatment services, it's key to have policy implication in the development process, and that policy is also based on evidence that if treatment strategy in political frameworks, legal frameworks are not supportive for the principles that we are mentioning now, and the development of
it's like in Mauritius and Zanzibar, it's very, very alarming situation. So what is the framework to organize our response to HIV among injecting drug users? There is the UNGAS Declaration on Drug Demand Reduction from 1998, which has a component on prevention of the adverse health and social consequences of drug use.
Thank you.
I would say I think it's a mixture of both, but probably that currently it's still but this is purely speculation. It's my opinion that it's still a lack of political will in many countries. And now currently, for example, we have a needle insulin program in Europe, is in Western.
professionals. Wondering whether there was any consideration in your discussions around what the minimum standards may be for those providing services.
No, the discussion did not go into. We had not only in that discussion, but also in other for injecting drug users. But despite advice from experts that OST is drug treatment and should be available to opiate users, even those who do not inject, as treatment in its own right, as well as a measure to prevent transition into injecting in the first place, there's been no progress.
While there might be some changes you would like to see because you haven't seen that text exactly the way it was on the screen, but that is what we negotiated and agreed to. We will not open it. This document is not open for further negotiation. What we will do is go through it and ensure that there are no errors of fact or omission, because we just want to make sure we got it right that way. But please, I ask all of you to...
A little happy and a little unhappy. We could not have asked for anything more.
People have been very gracious with their compliments of the chair and the tag team up here, because it is a tag team. But if people aren't prepared to have the movement and discussion and to reach out and have corridor discussions as we had.
Very much, and I look forward to working together with you. Thank you.
Thank you, Madame. I'll turn it over now to Sandy for his remarks.
Thank you, Michelle. I too will spare you the agony of a long speech and keep it short and sweet. First, I'd like to just recall this opportunity to commend them, my colleague Mirella Sumatrani and her whole team for all the work that they've done within this. I will not have the temerity to go over a list of names or of organizations which have gone into making this forum possible.
Session. Allow me to thank a lot of people: David, Eva, VNGOC, translators, volunteers, UNODC, Mirella, and her staff. I mean, it's been a tough slug at the beginning just to get this created as a project. Never mind to get the money funded. The funders, the government people who are in the room here. And not everybody, from the government side is saying, do we really want to open the door that wide to these NGOs? And I think what we've
with UNODC, and I did it part of my enthusiasm and belief, and certainly also part of my job. It was a great pleasure during this year and a half, because it's not something that started 1 month ago, but to work with Michelle, David, Barbara, and here I think a lot of organizing committee. Wolfgang, thank you.
Thankful task to try to satisfy everybody's smallest whim from the document, in starting with writing all the documents or most of the documents of the background, recruiting the volunteers, 17 of